Hi everyone, welcome back. My name is Ken Yagi. I'm the Chief Veterinary Nursing Officer at the Veterinary Emergency Group, and we are here today with Chrissy, Giovannielli, Erin Spencer, Marlaina, Hrosch, and Gabby, Garcia to talk a little bit more about our profession. And so the topic today really is about how the pandemic has affected our relationship with the pet owners out there. When we think about the media coverage that the veterinary field has gotten regarding this topic, there's headlines like COVID-19 pandemic magnifies workforce crisis in veterinary field, or things like the veterinary backlog, staff shortages made worse by the pandemic. And so I think we've all heard or seen some of the stressful interactions that we had with the pet owners out there between the veterinary team and them. And so what kinds of things have we seen?
I think the hardest thing at VEG at the beginning of COVID was we had to do away with our entire concept that we knew of open hospital, bringing people into the back, everything that made VEG so special and unique and made customers want to come to us. So just not having them there not only made it more stressful because it was taking longer to get things done, but customers weren't as happy because they were being separated from their pets again.
I also think it was compounded with the things that everybody was stressed out and worrying about during the pandemic. And I do want to wear a mask, I don't want to wear a mask. You're standing near me and you're not wearing a mask. And so we had policies we needed to put in place to keep our staff and each other and our clients safe. And some clients were really great and understanding about that, and some, didn't want to wear that mask, didn't want to have to follow certain policies. And then we had that extra layer that we had to help educate and work around.
And so when you say the clients weren't as happy, did that lead to any kind of interactions?
Well, I think also during the entire pandemic, definitely everything was impersonable, you're not having that communication, you're not talking to, everything is over the phone. So it definitely affects mental health, the fact that I have to talk to somebody over the phone or over a computer and not tell you, it's definitely taxing on the brain, because I rather communicate with someone in person than using the technology, so I think that's also was very hard for us.
That's a really good point, because we've gone from, like Marley said, a place where we would have people openly in the hospital to having to leave them outside of the hospital. And so how has that affected our teams?
I think doing euthanasia in the street was hard, the one thing that I was lucky about, or we were lucky about, is that at least we got to see each other, during quarantine. We were there for each other. I just think,
I think that was the biggest thing, is one of VEG's core values is togetherness, and despite not being able to have customers in the back, we still had each other, we still had that togetherness feel, and we were all going through it together. So if that customer was outside angry because they couldn't come in the building, or they had to wear a mask or whatever it was, we had each other to fall back on and know that we're not going through this alone.
Mm-hmm.
Having come into VEG kind of mid-pandemic, I saw that. The teams that I encountered when I first started with VEG may not have felt like you were in a great place necessarily, but were in a much better place from a team dynamic than some of the other teams I'd experienced in the previous year. And I think that was a huge part of it. Having togetherness is such a core value and something that VEG looks to do. Made it easier, I think, a little bit when you were dealing with those things, like having to deal with the euthanasia in the street, or a client that's upset because they had to wear a mask or couldn't come in, whatever that was, for all the other hard things we were dealing with.
So I'm going to throw a different question out there. So when we think about stories that we've heard, maybe outside of VEG or wherever it might be, what's some of the worst case situations that arose?
I think the worst case situation that I'm aware of is people who were so upset that they couldn't be with their pet, or they weren't being seen fast enough, that there were actually death threats, bomb threats sent to hospitals because the people wanted their pets to be seen.
Yeah. At some locations, even police had to be called because owners that were told they couldn't come in and that insisted they wanted to come in and forced their way in some hospitals because they felt so desperately that they needed to be in there, and then berated the staff because they were so upset they were told they couldn't, and screaming threats of violence rose where, I mean, we had nurses and assistants afraid to come to work because they were afraid that they were going to be hurt by some clients.
And so that might be some of the worst case scenarios, and I'm sure there's a huge range of interactions that we've had. And so just thinking about it from the pet owner's perspective, like how does it look from their lens that may have caused these kinds of things?
I think they just, I always think of, I don't trust anybody that calls me on the phone. So you're thinking about everything happened on the phone. You never got to meet that veterinarian. That relationship means so much to building trust. And so they just, and this is an emergency, right? This isn't a rabies vaccine we're talking about. So my sick animal showed up. It went into a building that most practices you can't see into. You know, as much as we try to be open, they're supposed to be in with us. And so now they don't know what's happening. Their pet's been away from them. Some stranger calls them on the phone and says, I'm a veterinarian and here's what's wrong and give me lots of money, and you've potentially been out of work because of COVID, especially early on. And it just all came together. And we say this was the pandemic, but Chrissy and I were just talking about this a little while ago. There was a lot more going on in the world that was stressing people out over this time. And so coming in with that stress, now you have a sick pet, and now you're dealing with a bunch of people that you don't really get to meet. I mean, I was doing some relief work, and I was the only person they met face to face, and I triaged. Like, that was it. And I took their pet away, and that was it. So I think that was, from their point of view, there's a lot of stressors going on, and that doesn't necessarily excuse some behaviors, but the frustrated person, I totally get that.
Yeah. The whole world was ready for a fight on both ends, honestly. Like, as working in the vet hospital, we were expecting that client before they even stepped out of line. We were expecting it because we were being inundated every single day with it, and the client as well. Every interaction that they go. I mean, if I went to the grocery store, I was expecting someone to be upset and yelling. So the clients were coming in expecting a fight, and everybody was in this really elevated, intense situation where it was just like electric all the time, static, shocking one another.
Yeah, and basically, you know, you're outside with a stranger and they're looking in because, you know, thankfully VEG is an open hospital, so you can see everything in it. But they're talking amongst each other, saying like, hey, how long have you been waiting? Oh, I've been here for 7 hours outside in the cold. Like, oh, I've been here for 8. Like, oh, so let me just call them. And, you know, like everybody just had an attitude, hostile. And I get it, you know, like completely get it. But from their point of view, they're probably looking out in the end and being like, what are they doing? What are they talking about? They look like they're not even busy. Like, why? Like, what they're in a group huddle, like, you know, so probably from their perspective, they're like, what's going on?
Yeah, for sure. So I guess it's hard for us to see things from what it might look like from their end. And when we talk about it sitting down like this, then it becomes a little bit more clear on what their experiences may have been. And so what are some ways that you guys can, think of or present to others in terms of how to diffuse some of that tension and have a much more positive relationship going forward?
I think part of it is reminding the pet owners that we're pet owners too. That is what I will always come back to. If something happens to my own dog, I forget everything I know about veterinary medicine. You would never know I worked in the field. So I know that when owners come in and they're freaking out, that's the exact same way I get. So reminding them, I'm the same way with my dog. I would be nervous too. We're here to help. So what can you tell us, or how can we help you to help your pet get better?
I think patience too. As a person, you just have to be patient. Just let the person know, also the client, that we're in this together. You know, like we're all living it together. We're in it together. Like, and you know, it costs $0 to be kind. So it's just like, just be nice. Like, it doesn't kill you. Be nice to everybody. You know, like especially the owners. We're doing it for the animals. You know, treat them with respect. So patience, respect, and just kindness overall.
Putting yourself in that person's shoes, Again, to your point of, we're all pet owners, but okay, how would I feel in this moment, and all of those pieces, and I tried really hard not to take things personally during the pandemic. That person that's venting their stress on you, it's unfortunate, but it's not you. And if you can leave it, let it roll off your shoulder and keep moving and understand, even if you don't understand exactly why, understand it's not about you, then that sometimes makes it easier.
One of the things I always say in our nursing orientation is nobody brings their pet to the ER because they wanted to have fun for the day. They brought them in because they're scared and they feel it's an emergency, so we need to treat it as such.
Mm-hmm. I heard a great example shared of us using our values and our spikes throughout the pandemic of finding a way to say yes. I think part of what made everyone so stressed out, so angry and fearful was they felt stuck. They felt there was no choice, there was no options. You had to do it this way. You're being told at every moment you have to wear a mask, you have to do this, you have to. So everyone felt very stuck, very almost like a victim. So going to a hospital and now being given again a set of rules that you have to follow, but then voicing your concern and saying, you know what, these are our policies, they're here for a reason and we have to follow them. But I can pull that table over to the glass window and you could stand right on the other side of that glass window and still be with your pet. So finding a way to say yes made all the difference.
So I think that obviously being able to put ourselves in their mindset and having a little bit of empathy, and then finding creative solutions in which we can maintain the good values of the pet owner and the veterinary team interaction is probably going to be the solution. And how we do that I'm sure will continue to evolve as things progress. So yeah, thanks for all your thoughts on that. I think that's a good discussion for this topic. And so I'd like to thank you for joining us today for this conversation. Make sure that you subscribe to our channel. There's going to be a lot more of these conversations happening, and we'll try to get all kinds of different perspectives on a variety of topics. Thanks for joining us today.